Hello, and thank you for taking a little time out of your day to learn more about some of the exciting developments for the state of Wisconsin in regards to infant and early childhood mental health consultation. In February 2022, Wisconsin's Joint Finance Committee approved $5 million to build a statewide infant and early childhood mental health consultation program to assist early care and education professionals in addressing challenging behaviors and reducing program expulsion. This is huge. While infant and early childhood mental health consultation is currently available to select regional early care and education settings through Behavioral Health Wisconsin, the funding approved by the JFC in early February is intended to build the infrastructure in a system for infant and early childhood mental health consultation that would be available statewide and to all early care and education providers. It is important to the Wisconsin Alliance for Infant Mental Health that this system is built from the vocalized needs of the field so that it is both responsive and value added to directors, providers, and the children and families they serve. To aid us in this effort, we hope to hear from you, early care and education owners, directors, classroom teachers, and other professionals supporting this vital workforce. We know early care education is the backbone to a thriving community, and so it is pivotal that any services designed to support this important workforce is informed directly by the workforce. In this brief webinar, you will learn a little more about WeAIM, as well as infant and early childhood mental health consultation and its benefits so that you will have a better understanding of what's possible to in turn help inform the opportunities and barriers you see for consultation expansion. Again, it's important the state is designing a system that works for the field, and we hope that you will participate in a brief needs assessment survey after this webinar to inform the development and implementation of this system. So who are we? The Wisconsin Alliance for Infant Mental Health, also known as WeAIM, was established in 2001. We are a statewide nonprofit organization dedicated to the promotion of social and emotional well-being and relationship-based practices through raising public awareness, providing resources for professional development, and advocating for policies that are in the best interest of infants, young children, and their families. At WeAIM, we believe that all early relationships matter. It is our vision that all Wisconsin infants and young children will reach their fullest potential through nurturing and consistent relationships within the context of family, culture, and community. Now, before we delve a little deeper into ways we use infant mental health to inform engagement with infants, young children, and their families, I want to take a moment to ground ourselves in shared language. What do we mean when we say infant mental health? When we talk about infant and early childhood mental health, we are talking about healthy social and emotional development in young children. That is, it is the developing capacity for a child from birth to 5 years old to form close and secure relationships with adults and peers, to experience, manage, and express a full range of emotions, and to explore the environment and learn, all within the context of family, culture, and community. Everyone who touches the life of a child has the opportunity to promote social and emotional well-being, and professionals who work with or on behalf of infants, toddlers, and their families to promote social and emotional development and support early relationships are considered infant mental health professionals. So perhaps you haven't thought about yourself in this way, but if you are viewing this webinar, you yourself are likely an infant mental health professional. So what is infant and early childhood mental health consultation? It is a collaborative and preventative approach to problem solving and promotion of social and emotional development. Consultation teams a mental health professional with early childhood professionals to build the capacities of providers and families to meet the social, emotional, and mental health needs of infants, toddlers, and young children, utilizing relationship-based and culturally attuned practices that are sensitive and responsive to the unique needs of the child, family, provider, and organization. Ideally, consultants are embedded within an early care and education program. They have strong working relationships with the entire staff and are building adults' capacities to engage in ways that are proactively supporting the relationships and environments that help infants and young children thrive. Consultants can also be available to support staff when child-specific concerns arise, and a provider, child, or family is in need of some additional targeted support to address any factors that might be impacting the social and emotional development of a child. Let's take a closer look at what consultants can do. Operating from the premise that all relationships in a child's life matter, infant and early childhood mental health consultants work to promote both strong relationships and supportive environments for children, both of which are key to brain building. Consultants build the capacity of the adults in children's lives to improve their ability to prevent, identify, and respond to the mental health needs among children in their care, so children are supported in all settings where they learn and grow. Consultants are highly trained, licensed, or license-eligible mental health professionals with specialized knowledge in childhood development, mental health, trauma-informed care, and culturally attuned practices, which also address disparities and implicit bias that could otherwise impede positive outcomes. Consultants utilize a consultative stance that acknowledges supporting children's mental health is a shared responsibility, with every important adult having knowledge and skills to support a child. The consultant utilizes a collaborative, teaming approach in keeping with the idea that two heads are better than one, in order to mobilize the collective resources of families, staff, programs, and communities so that every child can thrive. In programs and environments where directors and providers have access to quality coaching, such as in the form of Youngstar or pyramid model coaches, an infant and early childhood mental health consultant would work alongside coaches, utilizing their combined knowledge, that is the coach's knowledge in universal practices, as well as the consultant's knowledge of mental health relationships and systems, to support providers, programs, children, and families, leading to the best outcomes. In programs without coaching, a consultant can serve as both a coach for universal practices while also bringing the additional knowledge and skills for supporting mental health, trauma-informed perspectives, and culturally attuned practices. Consultants are also skilled in addressing complex relational dynamics and could enhance programming by supporting families to create greater familial engagement, collaboration, and consistency between home and classroom environments. While consultation can have a therapeutic effect, and consultants have extensive mental health training, it is important to clarify that infant and early childhood mental health consultation is not therapy, nor do consultants provide therapy to children and adults in the context of the consultative relationship. In the consultative stance, consultants do not engage in direct interventions with children in the absence of engaging the adults in relationship to a child. While consultants may provide some coaching and modeling to providers and parents around new skills, they are always working to build the capacity of the adults to respond to children rather than directly intervening with children in the absence of engaging the adults in relationships surrounding the child. If traditional therapy is also identified as a need for a child or an adult, the consultant does also assist with resource referrals and can also help create a collaborative bridge between therapy and the classroom and home environment. Let's take a closer look at some consultation activities. Infant and early childhood consultation may include classroom observations, screening or assessments, sharing tools and insights to address specific child or family mental health needs, as well as to refer them to outside mental health services when appropriate. It can include supporting development and implementation of individualized plans, which can include both universal or child-specific interventions. It can provide reflective supervision and consultation to program staff to assist them in processing their complex work with children and families. It also supports family engagement and consistency between classroom and home environments, such as participating in family resource nights, home visits, or providing coaching to parents. And it can also include support for administrators related to policy development and implementation of evidence-based practices to support mental health and social and emotional development and skills. Infant and early childhood mental health consultations' robust support helps to provide self-reliance, mental health awareness, and the confidence to effectively promote social and emotional development and intervene early in a child's life if concerns do arise. Using evidence-based, collaborative, and culturally responsive services, infant and early childhood mental health consultations successfully supports early care education and programs to improve child social and emotional skills, improve child and adult relationships, increase provider and family collaboration, reduce and prevent preschool suspensions and expulsions, increase program quality, as well as reduce provider stress, burnout, and turnover. To inform the development of a statewide infant and early childhood mental health consultation system for the early care and education workforce in Wisconsin, WeAIM has been engaging in needs assessments through focus groups and surveying of the field. We would greatly appreciate you taking a few minutes to complete a brief survey after this webinar to share your own thoughts and perspectives now that you know a little bit more about consultation. You can do so by cutting and pasting the URL link embedded in this slide and completing the electronic survey. Your feedback is greatly valued and will assist in building a system that is responsive and value added to directors, providers, and the children and families you serve. Thank you so much for taking time to view this webinar and provide feedback on ways infants and early childhood mental health consultation can benefit your program. As the professional home for infant and early childhood mental health professionals in Wisconsin, we'd also love to stay in touch. If you are not already, please consider subscribing to our monthly newsletter, becoming a WeAIM member, attending our annual conference, or learn more about additional professional development opportunities we offer through infant mental health endorsement, pyramid model implementation, the Reflective Supervision Learning Collaborative, and more. Together, we can make a difference in the lives of infants, toddlers, and their families, and help ensure all children receive the care and early relationships they need in order to reach their fullest potential.